Hello, good morning to everyone else in Australia, and good evening to those on the other side of the world. Thanks, Tessa, for joining me. It's really great to see you.
Yeah, same, same.
Well, we'll start with you, Tessa. Do you have any questions?
I was thinking about that because I was like, I'm joining. What am I going to ask?
Yeah. Well,
But
you had on the Physio Hub, you were asking about training without treats. How's that going?
that's a struggle.
Yeah.
um, but there are some things that are easy for us to do without treats, because she just find it funny to do. But she used to be really food motivated, so doing something without treats is hard. She's also toy motivated. She's just at the moment she's not motivated.
Wow, it's
So
so hard. So
we have
I
to really
guess
see what she can do. Yeah.
I guess the first thing to ask is, have you changed the treats? So sometimes I've noticed um with my dogs is that I kind of need to up the treats. I remember once I was training Kiba, my boy that passed away last year, and we went from dried treats to like cut sausage, because he just wouldn't do anything for the treats that I was offering him. So he's like, all right. He was calling my bluff. He's like, "What else you got? What else you got? What else you got?" And so I'm just wondering, like, it's fair enough if they're not food motivated, but I wonder if it's also the food selection itself. So, what are you currently trying to use?
We have upped it to peanuts because that's the only thing she wanted to do
Nuts.
something for.
Wow.
But also those are not interesting anymore. We are struggling with health issues and we cannot find out what is going on with her. So it's there's a lot more behind not wanting food. So, I think what if I would use cheese, I could make her do almost everything.
Yeah.
But we need cheese for her pills.
Yeah. Yeah.
Yeah.
Um, so what um what kind of meaty things have you tried to
Oh,
give
all the
her?
things, all the things. And we don't eat meat ourselves, so that makes it more difficult. But we, yeah, we have. I bought like the whole selection of everything you can find, and it's really. She just eats only in the evening, late in the evening, and the rest of the day she doesn't eat at all.
Right. Oh, see, that is really super hard.
Yeah.
So um yeah, like sometimes, so we've got a new dog. We brought him home
Oh,
last night.
oh,
His name's
exciting!
Dingo. And when I first met him at the shelter, he was not treat motivated. And I'm like, oh crap, what am I going to do? Because I'm like, if I don't know how, like pretty much all my training has been around treats. I'm like, you've really got to change your thinking in how you're going to do this. And so um, he was very toy motivated, and affection motivated. So I
Oh, yeah,
wondered if, I mean, we haven't started training yet because luckily he ended up being treat motivated in the end. But yeah, so like things like, I think it's a lot slower. It's possible, but it's going to be a lot slower to teach the dog. So, he
yeah,
loves tug. And so I was thinking, all right, if I wanted him to step up on a step to do a two up, I would have to get the tug rope and, kind of guide him up. And then
mm,
when he gets there, I'm like, yes, and then he can have the reward. But
yeah,
again, like, it's so much slower, right? Like it is so super duper hard.
yeah,
Um, and the same would be for affection. So like I would, try and guide him up and then give him praise or, the affection that he wanted. It's possible, it's
yeah.
just a lot slower.
Oh yes,
Um,
yeah.
so yeah, like I find that so we I have my own dog treat company as well. And so luckily, it's funny, Freya, she used to love these chicken treats we made that had um like some other kind of like vegetables and things like that. Whereas now she'll just like, nah, won't have that. So, but she'll have the plain chicken. She'll have
Yeah.
the plain chicken, and I can use that for her. But yeah, it's funny. Even within the session, it can change. You
Yeah.
know, it's like I like this treat, now I don't like it. It's like, all right, what other backup do I have?
Yeah. Yeah.
Um,
Yeah. Yeah.
and
Yeah.
and unfortunately, like I think, you know, like I don't like um buying them because I know they're full of rubbish, but the dogs love them. That's the problem. Is that those you know, those processed rolls of
Yeah.
meat.
Yeah.
And I know that she loves that, but she won't, like, I've cooked her steak, she won't eat it. I've cooked her chicken fillet, she won't eat it. I've given her, sometimes she'll eat eggs cooked, sometimes she eats them raw, sometimes she doesn't. Like, you know, and I think particularly with our senior dogs, they're so fickle in what they like that it is really, really hard. And I'm kind of glad we've got Dingo now. And I'm like, okay, well, whatever Freya doesn't eat, I'm like, Dingo can have, because I'm like, I'm not wasting food.
Yeah,
I
and that's
hate,
that feeling too, right? The wasting food.
yeah,
We find a treat that she really loves, and then the next day she's like, "No, I don't want this." Like,
yeah,
oh,
yeah, I
another
know.
$10 or $20. Those are extra,
Yeah.
and that's really hard. But the fun with her is that she also, I sometimes think, is like some exercises she likes to do, like paws up and sit and stand. Is I can ask that for like 10 times, and then she only need one treat or no treat at
Yeah.
all. But sometimes, like backing up, she doesn't like to do that, and then she does it. She
Yeah.
just like, no, I'm not going to do that. So it's also a combination of not wanting to do a certain exercise
Yeah.
compared to what do you have for me when I do this?
Yes, yeah. And I think that's when you know, the incidental exercise I think is kind of more important. So like for example, the other day we have a couple of food bowls throughout our water bowls throughout our house, and there's one in the bathroom. And our bathroom's quite small, so she came in to drink from it, and it, you know, she kind of rubs against my leg because, you know, there's not a lot of space. And then I refused to move and I made her back out. So she had to walk backwards.
Yeah, yeah, yeah.
So
We
it's
have a
try.
really narrow hallway there. I just
Yeah.
ask her over, and then she needs to back out again because
Yeah.
she cannot turn around there. She needs to back out. So
Yes.
like, come on, and then bye bye, and then she needs
Yes.
to back out. So that's what I'm actually doing. I try to find spots
Yes.
where certain exercises are
Awesome.
easier to do or
Yeah,
more natural
fantastic.
even. Yeah, yeah.
So explain to me a little bit about what you do professionally, and because obviously I think that that must be helping you do your exercises with Puck. So I think, yeah,
Yeah, I'm, yeah, you can call it a canine puzzle specialist.
yeah,
And so I use the Dutch hersenwerk method for doing puzzles with dogs. That is really focused on connection and yeah, really working together. That of course the dog solves the puzzle and the human only prepares the puzzle, but there's a
yeah,
lot of things going on while doing that. So that's where I focus on, that it's like a calming and enriching for both the human and the dog.
yeah, amazing. And I
And I
think
do
that's
sensory
really,
rooms too. Oh, sorry.
no, 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 you go, sorry.
I do sensory rooms too, where I am a dynamic dog practitioner. So I really also know how to look at movement,
Yes.
and those things combined are my sensory rooms, where dogs are getting an enrichment session, and the human and the dog get to watch the dog
Oh,
and to
amazing.
observe
And I
what they're.
Yeah, no, sorry. Finish. Sorry, I get excited and I
Yes,
interrupt.
just
Sorry.
observe what their choices are, how they move, and like all the behavioral, but also the movement stuff. So you can just observe anything when a dog is just doing that. So that, yeah, those are my passions.
Yeah, amazing. And I think that's such a advantage for you, because I think that sometimes we really need to think laterally. So we really need to think out of the box. And depending on um, like in our like everyday job, like we have to think out of the box. And so I think it's like trying to help find solutions to the problems that we're having come easier to us, as opposed to some other people that aren't trained in that problem solving strategies. Would you
Yeah.
excuse me for 1 minute? I'm so sorry, my husband's calling me and I'm worried it's about the dog. I'm so sorry. I'm so
No
sorry.
problem.
I am so so sorry about that. We got a new dog. Our car's breaking down. My husband's going for a new job and needs all this paperwork, and he's got ADHD. So I'm like the admin keeper of the family, and I'm so so sorry. Everything is happening at once. Um, but Tessa, that is just so wonderful for you to be able to provide that. And I think yeah, I think it's, obviously, what I set out in the programs is ideal, right? Like in the ideal world, when we have the time, when we have the space, when we have the dog that is willing to, we're not tired and they're not sore. And, there's so many things that can influence our ability. And I think you're doing great, like being able to think of other solutions. That's exactly what I would do. You're doing really well.
Thank you, thank you. And I have one more question for you too. What are your thoughts on swimming? It,
Swimming. Oh, it's funny. I presented a meeting, workshop the other day, and a vet asked me about hydrotherapy, in particular with water therapy. And I'm a little bit anti. And the reason for that only is because I feel that us as dog parents feel the pressure to have to um, like it's kind of like the answer to everything. Like if they've had surgery, it's water. And it's like, but why? I've rehabbed my dogs without the need for water. And
yeah,
and it's like, especially if it's far away, if it's expensive, it's very stressful for the owner. It can be very stressful for the dog. And I'm like, sure, like if you can afford hydrotherapy, if it's local to you, if your dog loves it, it's a nice exercise. But when we're talking about strengthening, um, hydrotherapy is can be progressed. So they can change the rate of the treadmill, they can change the incline, and that is a progression to make the muscles work harder. But overall, I believe that the only dogs that need water therapy um, will, are those that can't do land-based exercises.
yeah,
And that's from just a rehab perspective. Of
yeah,
course, like if your dog loves the water and you're at the beach, frolic and have fun, like, that's fine.
yeah.
But I wouldn't be putting the emphasis on that for strengthening.
No,
Yeah.
no, yeah, yeah,
So
yeah.
I
And but how do you feel about it when you know something is going on with your dog? That's not in our case, but if there's something going on with the dog, people always say, "Oh, yeah, just go to the beach or go to the lake and let them swim." Is that good to do? Because I have the feeling that you might hurt the dog even more when something is going on.
Yeah, no, that could be the case.
Yeah.
Because there has been, I haven't seen any scientific evidence to support it, but I did hear through the grapevine that people don't recommend water therapy for dogs with torn cruciates.
Yeah.
So prior to surgery, they don't recommend it because, you've got to think that when you go to the beach or the lake or whatever, you can't control the movement of the water and the force of the water. And so, what if it knocks down your dog? What if it puts pressure on that knee and then the knee moves and gets completely torn? Or, yeah, so it definitely can lead to injury. I I still think though that, if they're a little bit, if they're struggling in their movement, I mean, they've got to get a diagnosis. Like, I
Yeah.
know it's hard, but I'm like, how do you know what you're doing is going to work or be helpful or harmful if you don't actually know what the diagnosis is? So, um, yeah, so the first thing is always a diagnosis from the vet. And then I would say, well, if the dog can still walk on land reasonably well, like if they've got a bit of a limp, that's fine. If they're kind of like completely lame, then I'd say, okay, that's appropriate for water therapy. Um, but again, we have a diagnosis, we know what's going on. We're going to try and do weight bearing under the water, which is easier than on land. So that's when I would say that's when water therapy is helpful. Pardon me. But generally, yeah, yeah, see, and that's what I'm trying to kind of, you know, push up against, create a bit of resistance because it's not always the solution. And people just automatically say water, water, water because it's easy. It's
Yeah.
like, it's easy, but is it too easy? And it's actually not
Yeah.
going to strengthen your dog. Is it
Yeah.
dangerous? Because, yeah, because of depending on the water, yeah, it can knock your dog over if you do it on open water. And does your dog actually like it? I think it's cruel to force our dog to do hydrotherapy if they hate it, just to make us feel like, okay, we're doing the right job in, being the dog parent and we're doing hydrotherapy. Because yeah, I hate that social pressure.
Yeah. 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 I hate that too.
Yeah. Thank you. You understand. It's just, yeah, it is just really hard. Yeah, like, because the whole point in me creating the app was really to help people manage their dogs, in a stress-free way for them and for their dogs, because it's, comfort of your own
Yeah.
home, no strangers, no long awkward car trips, and it's affordable. Like, I just think that I don't want any dog to, you know, to have to miss out on rehab because the climate that we live in, things are hard, like financially, like and then we think that, okay, well, as a good dog parent, I'm going to put my dog's needs in front of, ahead of my own. And then, of course, we would do that because we love them. But then that causes stress on us because we're not paying a bill or, yeah, it's just, yeah, that's why I'm so passionate about home exercise programs because they're just, yeah, they work, they're
Yeah.
easy, they're affordable.
Yeah.
Yeah, so that's why I'm a little bit anti water.
Yeah. Thank you. Thank you for that. Yes. Yeah.
For
And
listening.
and
I kind of
I have to say I just was away for 2 weeks and I had a little circuit for my dog here behind me. I don't know, but you could. So
nice.
my husband had to do that, right? But of course, with him, she's like, yes. She gave him the paw. Like, I'm not going to do that. So so what he did instead, I said, just go in the other room and do the leg cavalettis and let her put her paws on something because there are things she really likes to do. Just do something else. Just make her move in some way.
Yes.
And
Yep.
so I could just give him some tips from your app that he could still do
Oh,
something because over
awesome.
here she didn't want to do it.
Yeah, well, no, I mean, yeah, that's yeah, I guess that's, going back to how to motivate her.
Yeah,
That's the
yeah,
the struggle.
yeah,
I guess, and I love circuits. Like, last month when like I videoed, I didn't have any programs. I just videoed everything that I did because I'm like, I like variety, but I don't want to confuse people and say that, there's all these different exercises. So I love circuits because it's easier on me.
Yeah.
Essentially, you're just kind of going around in a circle.
Yeah.
It's easier for me. And the time goes really quickly
Yeah. Yeah.
because, I don't need to bend over. I don't need to like stop and start. We just keep
Yeah.
flowing. I love
Yeah.
circuits.
Yeah. I
So
love
I
them too.
guess,
Yeah. Yeah.
yeah, no, they're great. So how many
Yeah.
minutes were you able to do with your circuit? Do you time it?
Yeah, I put the timer on like 5 or 6 minutes, and then I have I think 5 exercises in the circuit.
Yeah, awesome.
Yeah.
And so my next question is how and when are you progressing them?
I didn't progress yet because it was too because I was away and it was too messy. So I need to start progressing them. Yeah. Yeah.
Yep, awesome. Have you noticed any changes in her mobility or behavior since you've started?
Not yet really, but it has always been like up and down because we don't really, yeah, we have done the whole vet circuit, but we still circus, but we still didn't find really what's going on. um uh, so she's always up and down. So it's hard to say I see um that it's going better, but I do know it's helping her to stay in the shape she is now. So yeah, even if it's
Yeah,
not going better, I do it for just stabilizing the situation. Yeah.
thank you for mentioning that because I think sometimes we being in aged care, I my goals for my clients um is is not necessarily improvement but
No.
maintenance, and
Yeah.
maintenance sometimes is just as much as a win as it is
Yeah.
improvement, because as the dogs get older and as people get older, we'll naturally get weaker, and then we'll naturally be able to like do less. But if we're
Yeah.
able to keep steady, that's a win, because
Yeah.
otherwise if you weren't doing the exercises you would decline, and
Yes.
people don't appreciate that. And I'm like, okay, some people might give up on something because it's like, oh, it's not working, but it's like you it's like, but if it's not okay, and but only because they're saying it's not improving it, it's like, well,
Mm.
as long as it's not declining it, keep doing it.
Yeah.
Like, yeah, I
Yeah.
think that's just as much as a win. And I think that's so important. Thank you for bringing that up.
Yeah, yeah, yeah. It can be frustrating, but I'm like, yes, this is important for. I do my stretches for myself every day, so why shouldn't she do something every day or 6 days or 5 days a week? But because it,
Perfect.
it is really helping your body to feel better, and to keep in a certain shape. And I get the from the professionals, I always get the remark that she looks good muscle wise, and I want to keep it that way.
Yeah. Isn't it so lovely to hear that though? I'm like, whenever someone says to, I'm walking Freya and they're like, oh, how old is she? I'm like 13. They're like, oh, I thought she was 5. I'm like, yes. Because you're like, we're doing the hard work.
Yeah,
And the fact is, she's moving like a much younger dog, and that is a win. Like the
yeah,
fact that we're keeping them mobile in their senior years, it's a win. And I know it is frustrating, because yeah, it can be hard. It can be slow. Obviously, muscle growth is slow. We do have to be persistent and maybe not see changes for a few weeks before we
yeah,
do start seeing them. Um, but yeah, like it's good that you can correlate that, thinking that, yeah, I mean, people think for dogs, especially in Australia, it's like, oh yeah, they'll be right. It's like, but hang on, they've got muscles just like us. They've
yeah,
got joints just like us. We get stiff, we get
yeah,
sore, so do they. And it's just that mentality of, yeah, understanding that what benefits us will benefit our dogs as well. Yeah,
yeah,
and not many
exactly.
people see that.
No, no, but I live in a bubble where they always say like, use it or lose it. So and that's just how it is. And our walks have become shorter, so I know I need to do something else, to just keep her moving and use those muscles in the right way. Yeah.
You so with the walking, how many minutes are you doing and how often?
It depends on her. Actually, she has a toe with an superficial tendon tear, or it's completely torn. So since she has that, she doesn't always want to walk. And so sometimes we are outside for half an hour, and we go out a couple of times a day. And sometimes we are out for half an hour, and sometimes for 5 minutes, and it really depends. And she normally is a slow walker, so she's not like a runner or crazy. She's just like sniffing and walking, and we have like all kind of up and down. So
Yeah.
she's just puttering around when we are outside.
Yeah. Um, Also, yeah, I think, we always just have to listen to them and, yeah, just, yeah, it's their walk. It's not our walk. Yeah,
Yeah.
just giving them the space. It's like, okay, if you want to go this far today or this far, but also
Yeah.
obviously, sometimes dogs will just not stop and that's not good for them either. So, there's
No,
kind of,
no,
we need to, yeah, we need to also use our, sensible hat and say, all right, that's enough. We need to have a rest now. But I guess, um, yeah, like, oh, I lost my train of thought.
Yeah, we talked about the amount of walk, the time of how long
Yeah,
a
yeah.
walk
And I
is out.
think, um, yeah, that's what I wanted to bring up. So with her toe, um, are you doing any specific stuff for that? Is it front limb or rear limb?
Front. No, I don't. I know she's compensating to the other leg, of course. So her other shoulder gets gets more stiff,
Yeah,
because she compensates to the other side.
yeah,
And for the toe itself, I tried to do and help her, but that really, we couldn't find anything that made her feel better with her toe.
yeah.
So
Um, I guess so. The important thing is, so what pain relief is she on?
gabapentin and Galliprant,
How often is that?
both 1 time a day.
Do you give it to her at the same time of the day, like
No,
together?
no. One of them is
So,
in the gabapentin is in the evening and Galliprant is in the morning.
sure. Okay. I So because we're dealing with an injury, in addition to the
Mhm.
fact that we're dealing with how old is she?
11 and a half.
Okay, yeah. So we're dealing with a senior dog,
Mhm.
um, and so we've got muscle loss that we're doing the exercises for, but we've also got an injury, specific
Mhm.
injury, and so I guess this is the benefit of being able to chat and talk, is that I can give you kind of maybe more focused advice on
Yeah.
the injury. Of course, you need to double check with your vet. I'm not your vet. I don't see her. I don't feel her. I don't know, but a physiotherapist's view on treating the injury. So um so I would be doing weight shifts. So trying to
Okay.
get
Yeah.
her to weight shift onto the sore side. Like we need, because we don't want her, and doing the exercises after your pain relief is really important.
Yeah.
Of course, like I know it's hard to motivate her, but in the ideal world, I would be giving her medication, and then half an hour later, I would be getting a cushion, and I would be bringing the treat over, and then she'd be leaning on that soft toe, because we want those toe muscles to work.
Mhm.
And so that's what I would be focusing on. And then there'd be things like, are you doing any massage? Because I would be massaging those shoulders, particularly
Oh
the
yeah,
one
she asked
that's,
for that. Yes, she
oh yeah,
asks for that.
she demands it. I'm sure she
Yeah.
doesn't. Yeah, so I would be massaging around, those overworked, the overworked limb, particularly.
Yeah.
I would be doing some passive range of motion of the their hand, essentially, their front paw, just to make sure that everything is moving and there's no stiffness, which could be contributing to her resistance in weight bearing. And do you have a home laser device?
No.
No. Look, I know, they can be expensive and they may not necessarily work. But again, it just makes me feel better that I have something at home, and I know that, if Frey's kind of limping one day, I can put the laser on. It's theoretically it's light therapy that's meant to help to decrease inflammation and pain. And so I wonder if like if, in the future, if you're willing to invest in something like that, you can give her home treatments. The other thing I would consider is maybe if she's like after like a half an hour walk, or even if it's just 5 minutes, she might, if she's sore, like particularly after activity, maybe apply like a cold pack. Have you tried that?
No.
So applying ice can also be helpful. So we know that arthritic joints love heat, and we always want to keep arthritic joints warm. However, when there's an injury or when the arthritis has been flared up, it's kind of like new inflammation on top of the old inflammation. That's when we use ice to decrease that new inflammation. And so maybe try some ice therapy. So like a cold pack, an ice pack, and just see if she'll tolerate that. And I mean, especially because it's summer where you are, so it's a little bit easier to apply than in here where it's winter. Like, don't really want to put ice on, but sometimes we have to. So there's a few ideas to maybe think about for future.
Thank you. Sounds good. We're going to try that. And the weight shifting is a good idea too. Just do this. And do you think that's better standing, or sitting is okay too?
Whatever she can tolerate. Ideally, I would do it in standing. If she can tolerate it. If it's too hard for her in standing, if you can get a second pair of hands like your husband to kind of support her weight. So I would hold like her belly so that at least she's not putting all of her weight through it. But so if you just kind of support her chest, so that a little bit of the weight goes through your hand, but the rest of the weight is going through. So that's how I decrease the difficulty. If she's struggling with just weight shifts, I would take a bit of the weight off her by supporting her.
Okay, sounds good. I'm going to try that. Yes.
Awesome. Thank you. That's okay. Do you have any other questions?
No, I think I'm good for now. I'm going to start with your advice.
Awesome. And always feel free, ask questions in the hub. You can email me, and let me know. I'd really love feedback on if the way that I set up the exercise programs in the app. I got easy, medium, hard, and for different things. Is it are you happy with that? Is there anything you'd like additional? Just let me know. I just really want to keep improving the app.
Perfect. I will let you know. Yes. Yeah.
Awesome. All right. Well, good evening. Have a lovely night. Cuddles to the baby girl.
I will do that. And you have a lovely day. And good luck with your new.
Thank you. We need it. He's a puppy, and he doesn't have manners. We got him from the shelter, so he's 1.5 years old. So we've got our work cut out for us to teach him some manners. So yeah. All right. Have a great day or evening.
Thank you. Great day. Bye bye.